Assalamu alaikum, everyone. Good afternoon. Welcome to our first episode of Happiness Research Talks. My name is Dr. Janaibi. I'm the director of Emirates Research Center for Happiness. Myself and Dr. Tatiana from College of Humanities, we have collaborated for this great initiative. The idea was proposed by Dr. Tatiana to give a platform, a very solid platform in which all the researchers across the globe to give their thoughts about the research and well-being. Through these talks, we will have the latest information about the well-being and happiness research discussions. And actually, we are through this platform as well to enrich the area of research within this region. The series will give a perspective from the top researchers from different parts of the world. So our researchers were not going to talk only from psychological perspective, but also economics as today's talk. And we are hoping through this web lectures also to be the platform for all the decision makers, researchers, academia, and even as students to have the insight of what's going on across the globe in terms of well-being. Now I'll leave the floor to my colleague, Dr. Tatiana, to give the introduction to our first guest speaker of today.
Yes, good morning, good afternoon, or good evening to everybody, depending on which time zone you are joining. So we are kindly asking you to mute yourself and keep yourself muted during all the talk. We will have the opportunity to ask questions as soon our speaker will finish the talk. So let me welcome you to the first talk here in Happiness Research. Our first guest speaker is Francesco Saracino. And Francesco is a top leading economist who is doing long time research in happiness. He is working in StarTech in Luxembourg. And today he is presenting a quite new piece of studies. I'm fascinated, and I hope that you are also excited to learn many things in terms of social trust, how that affects, and how it can be possible to be the first vaccine against COVID-19 that we're experiencing now. So let's start our talk today. Francesco, the floor is yours. I think that we can give you about 30 to 40 minutes. We are collecting questions in chat. So please, all other participants, keep yourself muted until we have a discussion. And in case you have any questions, you can do it either raising your hand and we will give you the floor, the opportunity to ask question at the end of the presentation, or you can type your question in the chat. So, Professor Francesco, the floor is yours.
Thank you very much, Tatiana. Thank you also, Professor Noor, for giving me this opportunity. I am delighted and honored to be part of this initiative and very, very thankful for being invited here. Good afternoon, good morning to all of you who joined us in this online seminar. These are weird times, and we are lucky to have these new technologies that allow us to keep our work going, even in emergency time. Today, I am sharing with you the results from my recent work on the relationship between trust and COVID-19, but I will also try to give you a larger view on the model of development that Western societies have adopted and its implication for our future. To be more specific, in the next half an hour, 40 minutes, I'd like to raise basically 3 points. The first one is that I will argue that trust in others and in institutions favors recovery from epidemics with low social and economic sacrifices. The bad news is that the pursuit of growth at any cost destroys the social and natural resources. On the other hand, COVID-19 gave us the opportunity to rethink the world in which we want to live in, and in particular to reconsider our development model. I will conclude arguing that prioritizing well-being will make for a socially and environmentally sustainable future. I hope you will find in the next slides enough food for thought, and I very much look forward to interacting with you on this topic. My starting point is the evidence provided by many studies by now that shows that the number of outbreaks of infectious diseases are on the rise over time. You clearly see this trend in the first bar plot on the left side, top left corner of the slide. You see these are the number of outbreaks of new since 1980, when we started having kind of reliable and comparable data on this issue. Since 1980, the number of outbreaks has increased, perhaps much more than we even noticed. COVID-19 is just the peak of the iceberg that we all know about. Other such outbreaks have the name of swine flu or MERS, and so on and so forth. These are just to mention Ebola, just to mention some of the most well-known. The second bar plot shows that nearly half of all these new outbreaks have origin, meaning they are associated to pathogens that come from our interaction with wild domestic animals. And vast majority, third diagram, of these new outbreaks come from viruses and bacteria, just like our COVID-19. So this means that we will likely have to deal with new outbreaks of infectious diseases in the coming future. And again, we also know from COVID-19 that people around the world do not face the epidemics, do not suffer from the epidemics in the same way, both within countries and across countries. This bar chart, I'm showing the fatality rate, that is the share of death per 100 confirmed cases, set of countries member of the OECD states. What you see is that there are some countries, this is related to 23rd of May, so at the end of the first wave of COVID-19. You see that some countries suffered from COVID-19 much more than other countries. So the big that I raise is, how can we improve our response to epidemics? The first answer I will try to give is that trust in others and institutions allow us to better cope with epidemics. I use the plural, our answer is because this work is part of joint effort together with Stefano Bartolini and Giulia from the University of Siena. So it's a co-authored work. However, what can we do to improve our response to epidemics? Professor Harari, a well-known historian, clarified that countries worldwide basically adopted a range of policies to face the epidemic, just between two extremes. On one hand, what we can call authoritarian control, and on the other hand, the initiatives that leverage on people's empowerment. So of course, these are two extremes. In reality, each country is a mix of these two. But just to give you an idea of what this means, on the left-hand side, with authoritarian control, we can cite the well-known case of China. China adopted very stringent policies to fight the spread of the virus. They adopted, they tracked the movement of smartphones. They used face recognitions and body scanners to identify potential carriers in crowds. They even adopted drones to find people who do not comply with quarantine measure and sanction them. So there is few doubts that China managed with a strong fist to domesticate the pandemic. But this came at a huge cost for people. On the other hand side, we have examples of policies adopted, for instance, by South Korea or Japan, where these countries also introduced and leveraged on new technologies to fight the pandemic, but they heavily relied on the cooperation of the people. They did not have to enforce with the control the fact that people were complying with shelter-in-place measures. They need not have to force people to wear masks or to keep physical distance. Just to give you an idea, in one day, South Korea, it was the 9th of April 2020, just in one day, South Korea managed to administer 500,000 tests. This is a volume that is very hard to achieve in a country in which people do not want to comply with public authorities. Also, this strategy worked out rather well in terms of success in managing the epidemics. Now, the same gradient between these two poles is present elsewhere, like in European Union countries. Here you see a measure of government's response stringency as produced by, as published by our World in Data for a set of European Union member states. You see that there is a huge difference range from Sweden, that if you want is an outlier in this group, that introduced very little stringent policies, to Croatia, that on the contrary had a very strict control policies. The reason why I put the accent on these differences and on the differences in stringency is because these differences imply very different social and economic costs for the population. Just to give you an idea, there is a blooming literature since 2020, recent literature, documenting that post-traumatic stress, insomnia, depression, anger, loneliness have been soaring with the introduction of lockdown and quarantine measures. Economic costs. A recent paper by Dobson and colleague, published also in 2020, estimates the cost of lockdown to be between 8 and 16 trillion dollars. Just to give you an idea, the American federal budget, yearly budget for 2020, is less than $5 trillion. So it's a fraction of what we're speaking about here. So the reason why the measure is an important topic is because it has a direct impact on the socio-economic costs of a pandemic. So the question that I would like to answer is, what makes a country choose between one or the other extreme in this gradient? This has received very little attention in the literature. To the best of my knowledge, there is only one paper, also published in 2020, Frey and colleagues, who shows that basically the nature of the political system prevailing in a country determines the choice of policies. Frey and colleagues showed that autocracies imposed more stringent measures than democracies. Well, we want to contribute to this literature by saying that more than the political nature is the social capital prevailing, in particular the trust prevailing in a country, that that plays a major role in shaping this decision. Why trust? Well, trust in others and institutions are two key components of social capital, and they can enhance the efficacy of countermeasures to contain a pandemic or an epidemic, if you want. For instance, by promoting mutual understanding and solidarity, capital facilitates helping others, and in particular those more in need. Social capital also complying with the necessary measures to contain a contagion by promoting shared rules and mutual respect. All these aspects, solidarity, shared rules, mutual understanding, and respect are keys of collective action. They allow a society to achieve common goals while minimizing the amount of coercion that they need to impose on their inhabitants. Let me give you an example. Experimental evidence has shown that people's will to comply with general measures increases when they trust that everyone in their group will do the same. So basically, if I trust that everyone will wear a mask, I will also wear a mask. This means that trust allows us to solve the classic social dilemma of cooperation as posited by Ostrom in 1991. The problem is whether we have to choose between adhere or not adhere with containment measures. And the dilemma is that adhering is expensive for the individual, and the individual action is marginal. The contribution of each one of us to the general solution of the problem is marginal. So we face very strong incentives not to comply with measures. Well, the fact that we trust that everyone will join us in this effort gives us an incentive to comply. So this is why we believe that trust does play a role. Another reason why trust should affect the decision of governments is that if governments expect that people will not comply with shared rules, then they face higher incentive to adopt coercive measures rather than investing on cooperation. We decided to put this hypothesis to test. Trust in others and in institutions should reduce the stringency of government policies. And to answer this question, we decided to look at the countries that are members of the European Union. Why this? Because there are many reasons to think that political, economic, socio-cultural differences among countries could affect the choices they make to limit the spread of an epidemic. So we try to isolate for all these differences by looking at of rather homogeneous countries that differ mainly from one characteristic, the degree of trust in others and in institutions prevalent in that country. From this point of view, European Union provides a group of fairly homogeneous countries in terms of political, economic, and social-cultural conditions, as they are all members of European Union for now quite some time. We observe huge variety in the levels of trust in other institutions that prevail in these countries. In addition, so our hypothesis is that trust in other institutions requires less stringent measure. And also we try to show that this does not come at the expenses of people's health. To do that, we also check that peoples with less stringent countries that adopt less stringent policies do not suffer higher mortality or have more positive cases than others. Another measure we use to assess the efficacy of the effectiveness of policies, of less stringent policies, is the decline of new contagions from the peak. That is, how fast we go down from the peak of new contagions to, let's say, virtual zero contagions. So far, am I clear? Do you have any clarifying questions you would like to ask? All right. In case you lose me and you have clarifying question, just ask me. I will be happy to repeat. To do that, we collect data on trust in others and in institutions from the European Quality of Life Survey collected in 2016. So basically, our exercise is to check whether trust at one point in the past it's the stringency adopted today, the stringency of policies adopted today. We create an index using principal component analysis. I will be happy to share with you more details in case you're curious. I will just say that the EQLS provides information on trust and in a number of institutions, including the government, the parliament, judicial system, the press, and a few others. So we collapsed them all into one index, and you see the result of the index in this bar plot. The index reflects a bit our expectation that Northern European countries are report on average higher trust than Mediterranean countries. So all is as expected. And what we did is measure in relation with the measure of stringency I introduced before. And you can see a first evidence in this scatter plot. We find in our sample of 27 European member states, Malta is not included, that the higher people trusting others and institutions in a country, the lower is the government response stringency measured at the time of the peak in new contagion. This relationship is to various specification of our index of confidence. We tried with various combination of our variable of trust in institutions, and is also robust to the inclusion of various possible confounders. Just to give you a flavor of our finding, look at these coefficient plots. Here I'm showing you the effect of the association, the partial correlation between the index of confidence and our 4 dependent variables after controlling for the wealth of a country, its inequality, and a battery of controls that account for the situation of a country. Total death before the lockdown, which tells us how severe the situation is in a country. Total number of beds in intensive care units, which gives us an idea of how prepared is the country to face emergency. Average number of life years with chronic disease, which gives us an idea of what is the share of the population that suffers from chronic disease and therefore is most at risk of dying, or in any case is more vulnerable to the virus. We also account for the share of people that rarely meet others, because COVID-19 spreads a lot in presence of physical contact. So it could be possible that countries where people tend to meet others more suffer more from the pandemic. We included a dummy for young democracies because we observed that young democracies have on average lower trust than other countries, and we wanted to isolate this systematic effect. And for what concerned the remaining 3 variables, we also controlled for the government's response stringency 2 weeks before the peak. So let me give you a better insight of this picture. The first part of the diagram shows us that ceteris paribus, countries that have higher confidence in others and in institutions tend to adopt less stringent policies. And this does not happen at the expenses of having new positive cases, because the association is negative and significant after controlling for the government response stringency. Doesn't happen at the expenses of higher mortality. Here the is not statistically significant, meaning that trusting others, countries that trust others more and that adopt less stringent policies do not suffer higher mortality on the day of the peak than others. And also what we observe in this latter part of the diagram is that countries which confidence in other institutions is on average higher than others also experience faster decline of new contagions after the peak. So basically they get from the peak down to virtually 0 cases faster than others. It means that the virus had less time to affect people in those countries. This is why we conclude that societies where trust is high face the epidemics faster, with less sacrifices because they imposed less stringent measures on their people, and fewer new contagions.
May I stop you, Professor? I have a question for you here. It's a very interesting question. Mm-hmm. When you're measuring how the trust with the government actually reflect on how the contagious can spread out or it can be contained. So my question is, what are some measurements that the country or the government has done that gain the people confidence in them? Can you give us an example?
So basically, you're asking how the government can build confidence.
Very true.
Exactly. That's an excellent question. And it's also the most to address. The reason is that trust, both in others and in institution, takes time to build. And you will also see in the next slides, it's very easy to destroy. The first thing with which a government can build trust in its citizen is to be transparent, to do what they claim they will do, so to keep their promise. Under these circumstances, people can, first of all, be sure that when a measure is announced, it will also be introduced, and they may be more willing to follow up. Also, if the government is transparent, people have less incentive the reason for the government to adopt certain decisions or not. These are just two very easy solutions through which government can build trust. And I will give you more examples while we go with the presentation, because now I want to put the emphasis on how we can destroy trust. So the opposite of what we're talking now, rather than building. In fact, many acknowledge the role of trust and in general of cooperation in fighting a pandemic. But relatively few know that the way our societies are organized destroys social capital and destroys trust in others. So sorry if I do not directly answer your question, but let me illustrate my point. What I'm saying is that not only we need to build this trust, but we should stop destroying it. And the destruction is due to the way we organized our economic system. How does this work? Rather than showing a complicated system of equations, I will try to use images to take my point. The idea is that there is a family of models in economic growth as the outcome of a substitution process of free goods for expensive goods. And the outcome of this kind of growth is that it hampers people's well-being and destroys social relationships, in particular in others. Why? If people feel lonely, afraid, isolated, lost, they can seek compensation for their loss of well-being in market goods and services. For instance, if I am alone, I can invest any kind of amount of money to make my life as a lonely person more comfortable at home. If the place where I live is unsafe, criminality is on the rise, I may invest virtually any amount of money in devices to protect myself and my belongings from thieves and burglary. These are examples in which we are engaging in new layer of expenditures that economists call defensive expenditures to protect themselves against the impoverishment of the social environment in which we live. The fact that we lack opportunities for social encounters hampers our well-being and forces us to seek compensation in the market to make our staying at home more pleasant. The fact that we live in a environment, let's say criminal is perhaps a strong word, but you understand what I mean, pushes us to spend more money to defend ourselves. In all these cases, this new layer of expenditures in which we run into feed economic growth and also push harder because we need to raise resources to afford this new layer of expenditures. Both channels, working harder and expenditures, are registered in our national accounts and result in economic growth. At the same time, the fact work harder leaves us less time to invest in social relationships if we miss social relationships. Less time to establish a network of neighborhood friends that would allow us to have more confidence in the place where we live. So the result is that we end up contributing to economic growth, and economic growth feeds further eroding what is common. We react to this further erosion by engaging in a new layer of expenditures to and our well-being against this erosion. The result here is a vicious loop in which the erosion of what is public pushes us to invest in private solutions. So what I'm talking here about is a model of lives, of trapped, in which the poorer the social environment, the more we invest in private solutions. I want to really emphasize the fact that here we are adopted solutions that are private to solve collective problems. Therefore, it's like trying to empty a sinking boat with a bucket full of holes, because we are putting our effort to empty our effort at stake without to build what we really need, that is a net of social relationships. This system, as I said, creates trapped lives, because the more public goods are scarce, the more people invest in private goods. And this creates a self-reinforcing loop in which money, here is the slide, becomes central in people's attention, in people's lives, because what they can or cannot do without money becomes scarcer and scarcer. This is a society of lonely and isolated people that have less opportunity to build social relationships, because they are too much focused on working and keeping up in order to shelter themselves and those who love against the depletion of what is common and what is free. In fact, various studies documented that social relationships have been declining over time in many developing countries. Here I'm showing you just the tip of the iceberg, showing you the example of America. Figures from the General Social Survey, General Social Survey indicate that the share of Americans reporting to trust in the Congress have been steadily declining since 1970. Notice Congress is the institutions that is in charge of coordinating collective action. If people do not trust that everyone will do their part in a collective effort, and basically if they do not trust that the government is able to coordinate this effort, then they will turn to private solutions in order to protect themselves and those they love the most from social and environmental degradation. In sum, what I'm saying is that if we want to build trust, the first step is to stop destroying it, which implies we have to reorganize the way the economy works. And we will get to that in a short while. I want to finish to make my points before going to the proposal. And my next point is that the same mechanism that I illustrated for defensive growth, the vicious circle, also work to explain why the economy can be harmful not only for the society, but also for the environment. The idea, as you can see, is very similar to the previous slide. And what I'm trying to say is that environmental degradation is a cause and consequence, can be a cause and consequence of economic growth. If we live in a polluted environment where water is not drinkable, the air is polluted, and the town, the place where we live is too noisy, we can engage in a new layer of defensive expenditures to protect us against the bad being that the ill being that we derive from this. We could, for instance, invest in better filters for the air or to purify our water. We may invest in thicker glasses for our windows to avoid noise. Paradoxically, if the level of sea raises because of climate change, there is nothing else we can do but move our houses somewhere else, possibly in a higher place. These are all examples of defensive expenditures in which we have to engage in order to protect us against the bad from pollution. These expenditures feed economic growth, but they also require higher extraction of materials from the earth, higher production of these filters, and the production of plastics, which overall worsen the condition of the environment, thus pushing us to accelerate the rate of depletion of the environment. Again, what is happening here is that we are adopting private solution to solve a common problem. Yes, question for me.
No, I wanted to say that you have maybe 5 more minutes left so that we have some time for the questions because time is running fast.
5 more minutes.
Okay, 7.
Okay. All right. So what I'm saying is that this explains why why we may be facing new outbreaks of infectious diseases in the near future, because by destroying the environment, we are basically eroding the environment, the quality of the environment, and we are creating higher and higher possibility, more and more possibilities for diseases to emerge and affect us. I'm sorry I had to cut through this very quickly, but I would like to go to the positive part of my presentation. The point that I'm trying to make is that it's not bats or pangolins that pose a threat to public health, but it is our destruction of their habitats. And the destruction of their habitats, I try to show, has a common root in the way we organized our economies. So, epidemics are a textbook example of how much the survival of our species depends on our ability to cooperate. They're just an extreme example with more direct and tangible consequences than other environmental challenges like climate change. So far, that the consequences of these challenges were too far away or too uncertain to be taken seriously. But COVID has changed all this and faces us with an important choice to make about which kind of model of development we want to undertake in the coming future. We can continue with business as usual, waiting for the next crisis to hit us, or we may take the necessary steps to reform the way our economies are organized by putting human beings at the center of our decision making. What are our possibilities? Well, the good news is that defensive growth does not always have to be the case. Economic growth does not always have to be defensive. We know that there are countries in which the economy does not have to hamper the quality of the social, environmental, and the natural environment. These are countries that promote welfare schemes, protect social capital, and reduce income inequalities. These are probably countries that in which the economy grows more slowly than elsewhere, but presumably in a more compatible way with people's well-being. That is, better relationships with the others, better relationships with themselves, and with the environment in which they live. I want to emphasize that with the lenses of traditional economics, economic growth is considered a measure of progress. What I'm saying here is that if economic growth is defensive, then it does not mean that it improves the quality of life of people. And in this case, we need to abandon it as a measure of progress, and we need to take other measurements. So what is that we can do? Well, there is a lot that we already know about what makes for better lives and what can actually improve people's well-being. For instance, we know that an important correlate of people's well-being are social relations, which are the root of trust in others and then in institutions. We also know that money matters very little for people's well-being. In particular, it matters for poor people. Moreover, we know that money matters in particular for people with low social relations. That's what this scatter plot, which shows the relationship between the share of people that have high social capital in European regions with the life satisfaction gap between rich and poor people in the same region. So what the scatter plot indicates is that regions in which people share on average a higher social capital are also countries where there is less gap in well-being between rich and poor people. These are regions in which differences in money matters less for people's well-being. Also, social relationships are very important because they are an antidote to the loneliness industry. By loneliness industry, I refer to that part of our economy that grows by goods and services to people who have very little time to invest in relationships with others. You can book a date with a Moomin if you're feeling alone, or you can hire an Android pet that lets you caress it when you want it to, but you do not have to feed him or to take it for a walk. So it saves your time. And if you feel alone and you like singing, you can always rent a karaoke booth for half an hour and sing it to yourself. By the way, the shower is the first karaoke booth ever invented, and it is basically for free. An example of defensive expenditures, as you can see. By investing in social relationships, we also tend to increase people's well-being. And we know that happy people consume less, work better, and care more for the environment. For instance, together with Stefano Bartolini, I investigated data coming from 7 international data sets. We tracked people's well-being and their fears about the distant future. What we found is that people who fear that the future is going to be gloomy are on average less happy than others. And the size of the effect is comparable in magnitude to our other well-known correlates, like being unemployed or getting married. I know that I'm running out of time, but I will just go quickly through the slides. The second point I'm trying to make is that happy people are more productive. This we know from a burgeoning literature. Together with colleagues from the statistical office, we estimated that by increasing 1 unit life satisfaction in countries like France or Germany, we free productivity gains that are comparable to nearly 80 working hours. That is to say, we could all work nearly 2 weeks less per year while leaving unchanged our output. So I'm speaking about not stopping growth at the level that we currently have, and we could all work 2 weeks less and have 2 weeks more time to share our lives, to cultivate relationships with others, to meet others, to flourish, to invest in relationships. And this will probably make us less needy of money and of consumption to satisfy our needs. We may find other ways outside of the market. So that's why the message I'm trying to make is that by promoting economic growth, by social relationships, we can actually start a virtuous circle in which we foster people's well-being. People's well-being are also caring for the environment, and they need less money to satisfy their needs. And they have more time to devote to, for instance, so we could have an economic growth that is actually less defensive. This starts a virtuous circle in which promoting social capital policies for social and therefore for well-being could be the first step towards towards a more sustainable future. And this is why I was making my points at the beginning that trust in others and in institutions allow for fast recovery from epidemics with less social and economic sacrifices. Unfortunately, the way we organize our economy destroyed these relationships, and we need to reform this if we want to start take a pattern of more sustainable future. From this point of view, policies for well-being could benefit people and the environment in a sustainable way. Considering how we have been faring so far and the challenges that are accumulating to our horizon, I think it is high time to give happiness research a chance that things can be done in a different way. Thank you so much for your time, and sorry for having to rush to the slides.
Thank you very much, Francesco, for a brilliant talk. I think that we learned a lot today. So I would like to open the floor for questions and discussions. So please, if you have any question, you can raise up your hand and then unmute your microphone and ask the question. So shall we start from Ms. Nu?
I was very curious about the trust part. It was very, very interesting because I was trying to think about it in a different notion. If gaining the trust of people from the government is something very complex and etc., I was wondering how can we gain people trust on organization level, especially with the situations like, COVID-19.
Mm-hmm.
So what do you prefer? Shall we collect some questions, or you want to direct?
Yes, yes.
Because maybe there are more questions, so that we can have opportunity to listen to all the questions. I think Edward has some questions.
Mm-hmm.
Yes, thank you very much for your presentation. I sympathize a lot with your humanist approach, but I have a question about empirical part. There is a slide that showed correlation between stringency and confidence, and there was a negative relationship, but it seems that this relationship is driven very much by the one outlier, which is Sweden. If you exclude Sweden, then the pattern becomes not so clear, because consider, for instance, Bulgaria and Croatia. So I don't think that trust is any higher in Bulgaria than in Croatia, yet Croatia adopted very stringent policies, whereas Bulgaria very laissez-faire policies. So I wonder if it is possible for you to include more countries, including some outside of Europe, in particular Far Eastern countries, which seem to be very, very interesting in their policies and effectiveness, and see how social capital is related to policies there. Thank you.
Mm-hmm.
Can I have a question, please?
Yes, please.
Sure.
Right.
Yes.
Thank you very much. I enjoyed your talk. It's fantastic. You gave an overview of the social capital and the trust and the link with the quality of life. So if I see the whole scenario in a way, we live in a global context, global world, where one country is doing excellent and they have higher trust, higher quality of life. But in a pandemic situation, they have nothing to do sometimes, because we live in an interconnected world. Okay? Mm-hmm. So in that case, it might be difficult for some countries to tackle this sort of situations, because we learn a lot actually from this pandemic, and where good excellent countries, what we are saying actually, the countries who are running and who have that higher trust cannot manage this epidemic quite well. So if I give an example, in the UK, you can say we have the best NHS in the world, a lot of good other good things, but we couldn't save our people during this pandemic. So how do you see this global context and the local action within the political context, what you are talking about, the trust and quality of life?
Thank you very much for the question. It's quite clear. I see that Dr. Professor Bogdan Voico also wanted to ask the question.
Well, I will stay on the same slide that Edward commented on, and I would disagree a little bit with Edward. And my comment goes, but I'm not agreeing with the graph as well. So my comment goes in another direction, because the government response stringency actually it's okay to be used to compare countries which took the same kind of policy, but Sweden is different in this respect. And I think that maybe the fact that it's outlier over there actually confirms the graphics, because basically the Sweden response was based on high confidence. And I disagree with Edward. I think that you have almost the same line with how Sweden is probably only the intercept that it's a little bit lower. So my suggestion is to Francesco to consider if you should not have actually two indexes. One of them to have.
Can you repeat?
If it's not possible to have two indexes, I mean the government response stringency on one hand, and the other hand maybe a dummy variable define the type of policy, because Sweden and Norway were different with respect to everything as compared to the other part of Europe.
Mm-hmm.
Okay.
Okay.
So
I will start
I think
answering.
yes, yes, please.
Yes. So order starting from Professor Noof. To me, the answer to your question is building participation, giving the possibility to people to meet and to start something together. I am a strong believer that we should try to take decisions at the lower level possible, closer to the people, and involve them in the making process. This has one big requires one big effort, giving people the possibility to meet and giving them the time to meet. This is why I was emphasizing at the end of the speech that we could all work less while keeping our constant, because we need more time in our lives to build relationships with others, to have the time to speak with others. My perception is that many the best performers, according to economic measures of performance, the best performance are those countries where people spin on a wheel like rats, and they have very little time to dedicate to themselves and to the people they love. That's exactly the kind of world that feeds defensive growth. So it's there that I would they need most our intervention. We need to give people time, and we need to give them space to interact. Think of another feature of many modern cities. Cities were built for people to meet. They were built around squares. But then, starting from the Second World War, our cities in many parts of the developed part of the world have been crowded more by cars. Cars have made the environment in which we live, in which we were supposed to meet, dangerous. So another good policy to make people meet is to introduce more and more public spaces from cars where people can walk freely, green areas, public transport, good quality public transport. Basically, we need to rediscover and to trust the fact that there is a public dimension to our lives, and we need to get back to it. Let me be sure. Let me be clear. I'm not saying that we should go back to I don't know which time in the past. I don't think that in the past we were living better. I think that we have made substantial steps forwards, but now we need to find a new way to live for us to flourish as human beings, to really improve our quality of life. We have gone too much far on the extreme of focusing on economic growth as a way to improve our quality of life, and we have forgotten dimensions of our life that are important. So I think that the important role of happiness literature is to put these elements back at the center of the public debate and of policy making. Last but not least, say that in various countries we observe spontaneous attempts of civic society to aggregate, to create networks of relationships, also thanks to new media like Facebook. What they need is to find the ability to get all these networks in contact, because very often these are isolated groups and they do not talk to each other. We need to be able to create a network of networks for sociability to rise again. I take together the points by Edward and by Bogdan because they hit on the same chart. The short answer to both of you is that if we remove Sweden from the list, our results do not change. So I don't fear the role of Sweden as an outlier, the position of Sweden as an outlier in this case. I take Eduard's point in verifying Croatia, what's going on in those countries. As for Bogdan, you also raise a good point. Here we focus on the single index of stringency, but we could also do the same exercise for components of this index. So they have health measures, containment measures. We could try for the components. We haven't done it. It's a good idea. And I'm leaving the last point for Professor Hepfer, if I got it right. You're asking
Professor Hafiz. Yes.
Can you repeat?
Professor Hafiz Khan.
Harvis Khan, sorry, I misunderstood when you pronounce it. So if I'm not mistaken, you saying that there may be a conflict between local action and the global context. Am I right? Yes. Cooperation is something that holds within countries and across countries. One example, we saw it during the first wave of COVID-19, when medical equipment traveled to countries where the emergency was more severe, or the exchange of knowledge that took place to find solutions or best policies, best strategies to limit the pandemic. So there is no really a conflict between the global cooperation at the global level and at the local level. Rather, I fear nationalism. There have been some episodes of closing exports from medical equipment during the pandemic. Nearly 94 countries worldwide have closed their borders during the first wave of pandemic. And this ultimately was bad for the economy, but that's, if you want, trivial. It was bad for people's health because countries that needed that material were not able to acquire it. So I truly believe that we need an international dimension of cooperation as well. The solution is not in nationalism, definitely not. Did I answer your question?
That's absolutely fine. Thank you, Francisco.
Thank you.
I guess we are perfectly in time. It's 6:03, and I think we need to close our first talk. So if you have any more questions, you are free to write an email to Professor Francesco. So you can put once again your email address, if possible, on the screen. So I would like to thank Francesco for a fascinating talk and for bringing in so many ideas and thought to cope with today, at least this evening for many of us. And I wanted also to thank everybody for joining for our lecture today, our talk today. We hope you enjoyed it. And please, if you can answer the survey, right? So we have a feedback survey. We will be distributing the link currently now in the chat. So if Ms. Noof can help us. I wanted also to mention that this COVID situation allowed us to bring in for this fascinating talk, people from different countries. What I see from the participants, we have people from Romania, Russia, Japan, from London, from UK, from other countries, from UAE, of course. So from Luxembourg with our speaker. And I think that we have some participants from Oman and other countries in the Gulf. So we should thank this opportunity for Emirates Center for Happiness Research, that they provided this brilliant platform to discuss research on happiness. And please keep an eye on our announcements, because in December we will have a second talk, which is also a fascinating one. So we preliminarily agreed with a potential speaker. So very soon we will make an announcement, and you are most welcome to join us. We are trying to be regularly online on Tuesdays at 5 p.m. Dubai time. So please, if you have 1 minute to answer the questions, because we want to adjust the needs of the audience. It's very important for us if you can fill in the survey. It's like 5 questions only, because we want to know if timing is okay, if you want to be on the emailing list, and if you like the idea of this research talks, and if you want to bring in more colleagues, more speakers. So please let us know. So we are very open for being more transparent in research on happiness and well-being across the globe. And our main point and goal to bring in actually the vision across the globe, right, from different countries. Thank you once again, Professor Francesco. Thank you, Ms. Noof. If you want to say something.
Yeah, I would like to thank Tanya and Francesco for the great talk. And you may go first. Yes, go ahead.
No, please. I'm sorry.
So thank you so much for allocating the time for today's talk. I think it's very inspiring and very enlightening. I would like to remind the audience again that we have posted the survey in the chat box. We'll be very grateful and happy if you can answer those simple, straightforward questions. It will help us actually to bring in more speakers and give us more ideas on how to enhance our speeches next time. Professor Francesco, go ahead.
Yeah, I wanted to renew my thanks for this invitation, and it was really great to get to know you and also to meet many of my friends that I cannot meet in person these days. But a bit of advertisement, next year, June 28th, 30th in Luxembourg, we're challenging COVID-19. There will be a well-being conference. The call was published yesterday on Inomics. It will be circulated in many channels, so you'll receive a lot of spam, trust me. And
send this to us. We also will distribute
I hope I will manage to see many of you there next year. Thank you.
Thank you so much for everybody.